My name is Stan Berryman. My age is 74. I've been having some very consistent back pain over the last 2 or 3 years. That was an extension of the back pain I'd had for a good portion of my life. And it was time for me to get this fixed. And Dr. Smith had a good reputation, and that's what I was basing my visit on. The experience is you never know when the back's going to go out, when you're going to suddenly stand up straight with a feeling like electricity is going through your back. I could go for months without any problems, and then suddenly I would be laying on my back trying to get the pain to go away. For quite some time I was living off of aspirin and ibuprofen to try and keep the pain down. So it just consistently got worse. The older I've gotten, obviously the more pain I've had, and about 2.5 years ago I was looking at actually having surgery done when I was playing volleyball and I fell and ruptured my shoulder, and I had to get that fixed first. Used physical therapy for probably at least 6-8 months. It would reduce the pain. Sometimes it would go away for a short time, but then it always will come back. And then the other, I was getting nerve blocks, which actually reduced the pain for about 3 months. I think the longest in about a 5-year period that I was trying this, or actually not 5 years, about 3 years, was 6 months. But for the most part, 2 to 3 months, and the pain would be back. Well, you learn to ignore the pain as much as you possibly can, but it's a matter of just moving forward and trying to just cope with it. So, in my case, I just never knew exactly when my back was going to go out, and so being a lot more cautious than I think I would have been otherwise. I actually did my own research online and checked out his website, and I liked what I saw. I liked the reviews that I saw, and then I made an appointment to come and see him. And then after that, as far as I was concerned, that was the right choice I could make. Well, after we met the first time, I wasn't hesitant after that point about having surgery. I liked the fact that he sat down across from me with his laptop, showed me my spine, showed me exactly where the issue was and what would be done and would be necessary to resolve it. And that was a really nice approach. Usually when you go in, the surgeon will have it up on a screen, and there's a distance between you and the surgeon, and there's just not that level of confidence that I had. Actually, I've been feeling really good. The first week was a little tough, but by Christmas time, the pain was significantly reduced to the point where I could sit and have Christmas breakfast. So it worked out really. It's been getting better every day. Oh yeah, I definitely regret not having it done sooner. And if it hadn't been for the shoulder, I would have had it done at least 2.5 years ago. Nothing other than thank you. I really appreciate it. I also appreciated the time that you spent with me when I was in the pre-op in the hospital, and that was made me feel a lot better.